I think you know about the spirogram. Spirogram. Spirometer. What are lung volumes and capacities? What are the lung volumes and capacities? There are the 4 volumes and 4 capacities. Along with that, we are going to know about the timed vital capacity and maximum voluntary capacity and respiratory rate. That, and this is the recording of the spirogram. If in exam if they ask for spirogram, means you have to draw the label diagram of spirogram. In this, we can cover all the 4 volumes and 4 capacities. 4 volumes and 4 capacities. And the first one is tidal volume. Tidal volume means at the quiet inspiration and expiration, the amount of air that we take in and out, that is called tidal volume. Normal volume is 500 ml. If you see this one, this is the tidal volume. At the quiet inspiration and expiration, the amount of take in and out is called tidal volume. And inspiratory reserve volume. After the quiet inspiration, the amount of air take inspired, the more amount, that is called inspiratory reserve volume. And expiratory reserve volume means after the quiet expiration, the amount of air that we take inside, that the amount of air is called expiratory reserve volume. And after the expiration, the amount of air present inside the lung, that is called residual volume. These are the 4 volumes and 4 capacities is tidal volume. Definition: normal is male and female. Male వచ్చేసి 500 to 600 ml and female is 450 to 500 ml, and in newborn 15 to 20 ml. అలాగే inspiratory reserve volume normal volume వచ్చేసి 3 to 3.2 liters. అలాగే expiratory reserve volume 1.1 liters normal volume, and residual volume is 1.2 liters. And there are the 4 capacities are there. 4 lung capacities are there. In these 4 lung capacities, forceful volume and exhale and vital total lung capacity or vital capacity. Vital capacity means inspiratory reserve volume, tidal volume, and expiratory reserve volume. Vital capacity, inspiratory reserve volume, tidal volume, and expiratory reserve volume. These are the volumes and capacities. And if you see here, the vital capacity changes. Normal is 4.6 liters. The factors affecting the vital capacity means age, sex, and building the physical training. After the training, vital capacities are increased, and height, body surface area. When you ascend up or descend down, the vital capacities will be changed, and body surface area also change. And if you see, apart from this, if they ask pulmonary function test, in the pulmonary function test, along with this 4 lung volumes and 4 capacities, along with this you have to write about the timed vital capacity. Timed vital capacity. Please note it down. Please note it down because it is in practicals also. It is there. The timed vital capacity means the vital capacity is related to the time. Then we call as the timed vital capacity. That is in seconds. The percentage of vital capacity that is expelled with the maximum effort in unit time. And FeV1 and FeV2, FeV3, that is in seconds. Timed vital capacity is, by the timed vital capacity we can detect the diseases of obstructive lung disease or non-obstructive lung disease. Obstructive and non-obstructive lung disease. And how this test can be done means, after the quiet inspiration, the amount of air is forcefully expelled out. After the quiet inspiration, the amount of air forcefully expelled out. When you expel out, that is connected to the spirometer, and the amount of air is collected in measured within seconds. In first second, 80% of air should be expelled out, and in the second second, 90%, and third second 100% should be expelled out. If is there any obstructive lung disease like asthma, if is there any obstruction ankondi, the amount of air can be fully expelled out. So the percentage of air can be decreased. If that percentage of air is decreased, that indicates there is an obstruction. So that we can call as a obstructive lung disease. The normal values is FeV1, forceful expiratory volume. 1 means first second. Forceful expiratory volume at first second. 80% of air expel out in 80% of vital capacity. What is the vital capacity? Tidal volume, expiratory reserve volume. 4.5 liters low, 80% of air should be expelled out in first second. In the second second, 90%. In third second, 100% of air should be expelled out. Suppose if you are at the time of the examination, in clinical case, if these values 60, 70, 80, if they have given, that indicates obstructive lung disease. And if the normal value is there, non-obstructive lung disease. It is most important to detect the obstructive and non-obstructive. And what is the importance of the FeV1? FeV means the different obstructive lung disease and restrictive lung disease, and kyphosis, scoliosis, and fibrosis of lung in asthma. In those conditions that we can detect the or decrease the volumes. So please note it down. In every exam or in every practical, there is a clinical case is there. So according to the values, you can answer whether it is obstructive and non-obstructive lung disease. So this is the normal spine. At the normal spine, FeV1 values are normal, 80%. In kyphosis, the volume is decreased because they are having hum, and the chest rib cage will be decreased, and the volumes will be decreased. This is the scoliosis, one side bending, scoliosis, pigeon shaped chest. And another test is that peak expiratory flow rate. peak expiratory flow rate, and the device is peak expiratory meter. Peak expiratory meter, and these volumes can be detected by the both by electronic method and normal device. It is a simple method. The in that what we have to do, we have to take the deep inspiration, and forcefully we have to expel the air through this device. If the value is increased more than 150 or 300, that indicates normal. Here the volumes are there, the values are there. If the value is more than 350 or 500, that indicates values. Normal values. Peak expiratory flow rate. This is the device. Spirogram. So this is the lung function test. If they ask lung function test along with the tidal volumes and capacities, you have to write about the FEV1, maximum voluntary ventilation, and peak expiratory flow rate, and respiratory rate. Also you have to write what is the normal respiratory rate. Normal respiratory rate entama 12 to 16 cycles per minute. 12 to 16 cycles per minute. So this is the lung function test.